Lateral band walks. The lateral band walks exercise is intended to functionally strengthen the hip abductors in a lateral motion. Place a resistance band right above your knees. Bend your knees a little and take a few steps to one side and then to the other. Hip abductor weakness may lead individuals to adopt movement strategies to mask their weakness, resulting in compensatory motions at the lower back, hip, and knee. The target muscle is the gluteus medius. The partial squat position statically activates the gluteus maximus, and the sideways steps stimulate the superior fibers of the muscle, together with the other hip abductors. Note the band placement on the feet in these variations. In the first variation, the band is above the ankle. The placement change increases the load on the hip abductors because of the larger lever arm. In the second variation, the band is in the middle of the foot. In addition to the power that adducts the legs, this placement of the band creates additional force that rotates the legs inwardly. Therefore, it activates the gluteus maximus even more, along with the other hip external rotators. Monster band walk. This exercise targets the gluteus medius and gluteus maximus muscles. Place a band around both ankles. The higher you put the band on the leg, the easier the movement will be. Step your feet out to about shoulder width apart so that there's tension in the band. While keeping the band stretched, step one foot forward and out to the side. Then step the other foot forward and out to the side. Make sure that you're not only taking big steps forward, but also out wide to stretch the band. Don't let your knees cave in as you step or swing your legs, but step and force your glutes to work. Continue walking forward, taking big monster steps. Hip abductor weakness may lead individuals to adopt movement strategies to mask their weakness, resulting in compensatory motions in the lower back, hip, and knee. Gluteal weakness and ensuing hip dysfunction has a strong relationship with knee pathology, while a specific weakness in hip abduction and external rotation has been associated with patellofemoral pain syndrome. The target muscle is the gluteus medius. The tensor fascia latae, gluteus minimus, and the upper fibers of the gluteus maximus assist in hip abduction. The piriformis, along with the other hip rotators, stabilize the hip joint. The core muscles stabilize the spine and maintain the intra-abdominal pressure. Squat with mini band. The squat with mini